Good morning, everyone, and welcome to our webinar today. We'll just give it a couple of minutes for people to join, and we'll start in just a little bit. Thank you. Hello, good afternoon, and welcome, everyone. Welcome to our Working Well Remotely webinar series. Today's topic is how to foster happiness and well-being during a pandemic. I'm Michelle Quint, Executive Director of Health Human Resources, and I will serve as your MC for this session. This session is one of 8 topics that we have created to provide you with some ideas and tips on how to effectively manage through these challenging times. Last fall, we launched our first series of 7 webinars, and if you missed them, those recorded sessions are still available on our website, which we'll put in the chat box right now. A bit of housekeeping before we introduce our host and our speaker. This is a webinar format, so while you can see us, we cannot see you. You'll notice a Q&A box versus a chat box, so feel free to submit your questions during the session, and we'll try to get to as many of them as time allows. This session is being recorded, so if you have colleagues who missed today's live session, it will be available on the Working Well website. And so now, on to the main event. First, I'd like to introduce Dr. Michael Stamos, Dean of the UCI School of Medicine. Dr. Stamos, could you please tell us a little bit about yourself and why this session is of interest to you today?
Thank you, Michelle. First, I want to thank you and also Pamela James, Executive Director of Campus HR, for putting on these programs. And I'm delighted to play a small part in the program and have a chance to say a few words and really personalize the issue, which I think is pretty easy, quite frankly, because it's been a tough last 11 months, right? Who would have dreamt back in March of 2020 that we'd still be living the pandemic in February 2021? But we are, and the impact of that pandemic on all of our well-being is really profound. Just today, I was chairing a basic science chairs meeting, and our graduate student dean spoke up about the effect this has on our graduate students, about how wellness is so critical and so important, and of course it is, but nobody is immune, whether it's undergraduate students, whether it's graduate students, whether they're medical students, whether it's residents and fellows, whether it's faculty, whether it's deans. We're all impacted by the effects of the pandemic, the social isolation of sorts, the working from home, which has its pros and cons, as we've all recognized, and just the overall impact of what's going on in this world, and not to mention the other things happening in this world outside of the pandemic, including our political environment as well. So lots of impacts. I'm sort of known around the School of Medicine as being the eternal optimist, right? I'm the guy that's always smiling and always happy. And indeed, that is my general mood. But as I've also noted to a lot of people, if you don't have the downs, you don't recognize the ups as much. And so it's pretty normal to have some downs and some ups. And I would say this year it's been more downs than ups. And all these reasons are why I'm particularly grateful to have a chance to introduce our speaker, but also to hear her talk, because I'm quite fascinated by her work and by what she's going to say. So with no further ado, I'd like to go ahead and invite our speaker, Dr. Sarah Pressman. And Professor Pressman is a professor of psychological science at UCI, and she did her undergrad at Mount Allison University, and then did her MS, her master's and PhD in social, personality, and health psychology at Carnegie Mellon University, not far from where I went to school at Case Western. So I know that area well. And then she did a postdoctoral fellowship in cardiovascular behavioral medicine at the University of Pittsburgh. Again, a city I know pretty well. So great area. Love the Midwest. Had great years there. I don't love the weather, and that's why I'm now here, but that's okay. She joined UCI in 2013, and really her work, she seeks to understand how positive traits and states are beneficial for objective physical health, and explores the possible physiological and behavioral mechanisms by which positive feelings and behaviors get under the skin to influence biology, which is really fascinating. Pathways that she's examined include physiologic processes such as stress hormone reactivity, cardiovascular response, immune system change, as well as health behaviors like sleeping, exercise, and other leisure activities. She's especially interested in the role of positive psychosocial factors in protecting us against the harms of stress on our well-being. More recently, her work is focused on the importance of positive energy restoration from things like sleep and vacations. Well, guess what? Both of those have been somewhat affected by the pandemic. So really interested to hear how she gets past that. I've personally been doing virtual vacations. I don't know if you've explored those or not, Dr. Pressman, but I'll be curious to see your thoughts. You know, these different companies like Airbnb are doing virtual visits to cities around the world. Kind of fun. At any rate, her research findings have been published in top psychology journals and featured in media outlets, including the New York Times, the Wall Street Journal, and the Colbert Report. So with no further ado, let's give her maximal attention and time. Professor Sarah Pressman, thank you.
Thank you so much for that great introduction. And I am so grateful to have the chance to talk to you all today, to share my work with you today. You know, I think we hear a lot about health right now, about being safe, but mostly what we talk about is really policy and infectious illness, right? We're not talking about happiness. And you may even think it's a bit of a weird topic to talk about happiness and not things like stress and depression right now. But I'm hoping by the end of my talk today that I'll be able to explain to you why happiness is the secret ingredient that we all need right now. So the first thing I want to say is, you know, if you're watching this talk and you are completely burnt out, stressed, decidedly not happy right now, that is absolutely okay. You can still watch this talk. You will still get things out of this workshop today. You know, because right now we are in the midst of a world disaster, right? So it's completely adaptive for you to be feeling a lot of negative emotions, right? You know, if there was a bear that you saw poking its head out of the sewer and you decided that that was a good thing because you were supposed to be happy all the time, you'll probably get eaten by the bear. That's not good. Our negative emotions are actually quite functional. And in fact, they're especially functional right now because these feelings that we have of sadness, of depression, of anxiety, you know, these things are actually encouraging us to, you know, behave in ways that the CDC would like us to behave, right? If we're a bit scared, we stay home, we wear masks. You know, if we're sick, our body actually has a very adaptive evolutionary program response where when we have a fever, when we have high levels of inflammation in our body, it makes us want to avoid people and stay in bed. And that's good, right? That keeps us away from spreading COVID right now. It keeps us from getting sick. And so, you know, I would never say, I think a lot of people, when they hear positive psychology, the word positive psychology, they think, oh, it's like a happyologist. So we're trying to tell you to be happy all the time. And that's not what this talk is about. I don't want you to be happy all the time. I think it's adaptive and realistic that all of us are feeling a little bit stressed right now, that all of us are feeling a little bit negative right now. And that, you know, we have our highs and lows as we've gone through this long, almost year period of, you know, physical isolation and stress. But fear can go too far, right? Fear is, a common public health tactic. If you've ever seen those cigarette smoking boxes that like try to scare you away from smoking, this is effective. None of us want our mouths to look like this. We don't want our kids to have inhalers. But we've also learned in public health that fear can go too far, and that can actually make people, react in the opposite way and not do what they're supposed to. And in the same way, depression and sadness can go too far. And that's really the problem here, right? When our stress becomes chronic, in the short run, it's not so harmful. In the short run, if your blood pressure goes up a bit, if your immune system gets suppressed a bit, in the short run, it's actually okay. Our bodies are designed for that kind of acute stress. It helps us run away from that bear that we see pop out of the sewer. But at high lasting levels, those feelings of stress start dysregulating our body. Our immune system, because of these high circulating stress hormones all the time, stops working in the right way. We have worsened health behaviors. We're not sleeping. Sleeping is absolutely necessary for a host of properties in your body, including immune function, cardiovascular function. Our heart rate is up, our blood pressure is up, and over time that can, damage your coronary arteries and lead to problems. And of course, not surprisingly, this can lead to a host of illnesses, a host of diseases. There's so much data. I teach an entire class on stress on campus. I could go on and on about all the diseases stress is implicated in, but the answer is pretty much all of them. This is a real thing. And of course, mental illness, feeling worse, we have worse symptoms when we're stressed and we feel pain. And so, this chronic stress is really scary for health psychologists, for doctors. We don't want people to have suppressed immune systems, especially in a situation where, if you go out and do get sick, maybe you're going to get a worse variant, a worse and more severe COVID case because your immune system is so dysregulated from your chronic stress. And so we really need a way to break up this feeling so that it's not how you always feel. Like I said, we're not going to be able to get rid of it entirely. We're in the middle of a world disaster, but if we can just break it up a little bit, then we can actually help your body. We can help you be happier. We can help you function better, sleep better at night. So why focus on happiness? I'm sure you've seen a million different ideas of how to bust stress. There've been some great webinars, I'm sure were linked on things like, feeling calm and mindful and meditation practice. So why talk about happiness specifically? And the number one reason why I think it's important to talk about happiness is that it actually is one of the best antidotes that we psychologists have to conquering stress. And so this might be a little bit surprising to you, but what we know from research is that what happiness is doing is it alters a whole range of things that happen when we experience stress. So this is kind of an example from a typical stress reactivity study that I run in my lab, where we have you come in, we monitor some physical function at baseline, your heart rate, your blood pressure, your immune function, and then we stress you out. So we make you give like a speech in front of a bunch of people who glare at you, and we monitor your heart rate, and then we watch what happens after the speech is over. Psychologists can be nasty sometimes. We make you do stressful things to understand what helps. So but if you're in a good mood when you're going through these stressors, several things can actually happen. So first, being in a positive mood can alter your perception of that stressor. And so instead of having this huge increase in blood pressure or huge increase in heart rate, that is typical if you're in a bad mood, if you're stressed, if you're depressed, if you're in a positive mood, you might interpret that stressor as a challenge, as something that's exciting, as something that's fun. And so as a result, your body doesn't see it as much of a threat, and you don't have as much of a physical or psychological response to it. And then the other really key thing that positive emotion does is that it prevents this really bad response. One of the worst things about stress, it's not the reactivity. It's not the fact that we have this increase that's bad. It's when it stays elevated. So the stressor is over, there's nothing you can do about it, but your body is still responding to it as though a bear is chasing you. And that perseverative worry, that chronic anxiety is what keeps our body strained and exhausted over time and leads to these bad health outcomes over time. But what happiness does is it seems to have a role in undoing stress. If you can bring up a happy thought when you're going through something stressful, you just have that kind of relaxation response, and it helps you recover from it faster. And on top of that, we know that people who are positive, they might not even see some things as stressful, so it might displace stressors from even happening. And people who are more positive tend to engage in this behavior called broadening and building, which is written about in a great book by Barb Fredrickson called Positivity. And that's just this idea that when we're in a good mood, we go out, we try new things, we build resources. Like you try rowing for the first time, and so you become strong and fit, and that helps you during stress. Or you make friends because you start a hobby that you never tried before, and those friends give you advice and lend you money when you need it. And so there's a whole host of ways that happiness can help you. But I'm just going to show you a really simple example from my own lab to show you how like physiologically based and quick and easy this can be. So you may not be familiar with this idea of the facial feedback hypothesis. Dr. Stamos mentioned that he walks around smiling all the time. It turns out that's a really healthy thing, because when we're smiling, whether or not we are faking it or if it's real, that smile sends a backwards message to our brain saying, oh, you're actually in a pretty good mood. And clever psychologists have designed a host of studies to prove this. It's been studied, since the time of Darwin. Darwin even said if you can, fake an emotion, it's going to arouse that emotion in your body. So this idea has been around for a while. It's a bit controversial. People don't know how strong and effective it is, but it's pretty clear that, smiling has this very nice but small effect that improves your mood. It's not going to last a long time. It's not going to cure your chronic stress, but in terms of the ability to just give your body a little break, it seems to be really adaptive. And so in a few studies that I've done, we've had people come into the lab. We tell them we're studying multitasking, and then we have them either hold a neutral face position, a smile, or a Duchenne smile. This one on the right is considered a more sincere, true expression of positive emotion. It has those crinkles around the eye, which is really how you can tell if someone's is sincerely happy to see you, even if they're wearing a mask. If they have those eye crinkles, that's how you know. So what we hypothesized was that if you can get someone to fake smile in a really sincere way, that's going to help with their stress. And lo and behold, people in the study don't even know that they're smiling. When we have them hold chopsticks in their mouth while they do these awful, stressful tasks, either putting their hand in a bucket of ice water or doing this really difficult dexterity task where they have to trace a picture and it buzzes at them every time they make a mistake, and the experimenter's telling them to go faster. What we see is that the people who are Duchenne smiling, their heart rates recover from the stress at a much faster pace than people who weren't smiling in the red line here. And the fake smiling group that didn't have the eye activations right in the middle. And this is true across two different kinds of stressors, both a kind of social threat task and a pain task. And you might have seen in the UCI news recently, we replicated this and showed that if you smile when you're getting a vaccination, this is just a fake saline solution, but it was the same size of needle as we use for flu shots, that it actually makes it hurt almost half as much. So it drops your pain by 40% if you're fake smiling. So you don't have to even be happy. You just have to fake smile, and it tricks your body to thinking you're happy. And that drops your stress response. And this is also true of heart rate. So same effect as the last study. And so the reason why I like this example, it's not to say my research is the most important or anything like that. It's to just show that doesn't have to be hard. We don't have to come up with interventions that make your life, that take months and months, of effort and trying to really make you happy in a long-term way. Just tiny little tweaks of your mood and your perception can make a meaningful difference to the stressors that you're facing at a day-to-day basis. And this is just a picture of one of my participants doing the activity, Duchenne smiling while she was getting the shot right there. Okay, now beyond stress, I will also say happiness is hugely healthy. And most relevant to the coronavirus pandemic is that happy people get sick less, even in extremely cleverly designed studies where we bring you into a hotel and we experimentally expose you to a virus by putting droplets of it in your nose, and then we watch you and see if you get sick. And this includes studies of the coronavirus. This is work done at Carnegie Mellon University where I was trained. What we see in these kinds of studies is that people who come into this lab paradigm happier. So we ask them for the 2 weeks before they come in, how happy are you? How calm are you? How excited are you? That even though all of them are experimentally exposed to the virus, not everyone gets sick. So that's a really good message with COVID as well, is that, and this kind of explains the people who are asymptomatic to some extent, where people might be sick, but they don't know it. We give people virus in their nose and not everyone gets sick. Some people successfully fight it off or have no symptoms of it. And in this case, when we look at objectively objective colds. So this is not just I feel sick. This is the virus replicating in their body? Do they have symptoms? 34% of people who have those droplets put in their nose who are low in positive emotion. If you're low in positive emotion coming to the study, 34% likelihood of getting sick. But if you come in high and feeling happy and calm and excited, only 19% of the people got colds. And again, some of these viruses that we've done this with flu viruses, we've done this with cold viruses, we've done this with coronaviruses, and you see essentially the same effect. And the opposite is also true. People who come in more stressed are more likely to get sick, as you would expect. Okay, and it's not just cold. So if you're not worried about coronavirus, if you got vaccinated, you're feeling good. This is also just important for your general health. Happy people have a host of benefits to their health. They live longer, they survive illnesses better. I've done studies with experimental wound healing where you actually heal faster if you're in a positive mood. They just feel better. So there's lots of reasons for us to be focusing on this. And so hopefully I've convinced you that, okay, it's good for us, even in the face of a pandemic, we should be thinking about happiness and trying to improve it. So the first question you might have is, what is it? What is happiness? What is well-being? And two, what do I do? So that's what the rest of the talk will be focused on. So defining positive affect, there's a million different ways of doing it, but we generally talk about it as states. So it could just be how you feel right now. It could be how you feel today. It could be how you feel this week. Those would be shorter states of positive affect, but also traits. So how you feel in general. You could just be a more positive person that reflect pleasurable engagement with the environment. And this can be a host of feelings. It can be that you feel joy. It can be that you feel calm. It can be that you feel excited. Different people have different baselines. Different people have different ideals. And really, a lot of it depends on your age, your culture, all sorts of factors like that in terms of how you feel and how you want to feel. And importantly, there's all sorts of, I don't want to get into a philosophical debate about what happiness is and where it comes from today, but it can come from a lot of places. We can feel excited because we're buying a chocolate ice cream cone, but we can also feel excited because we just got our degree in, an advanced degree in medicine. So, there's a lot of things that can cause these feelings, but that doesn't really matter in a lot of these studies. We're just looking at, your affect, not where it came from. Now, if we're talking about well-being, that's usually considered a broader category. It could be your social well-being, so your social relationships. That could be a whole other talk. Those are also very critical to your well-being and your health. Physical well-being would be your physical health. Are you feeling sick? Are you feeling healthy? Cognitive could be like your optimistic expectancies, your life satisfaction, or just emotional, like we've been talking about. A common way to talk about happiness is to call that subjective well-being, which is a combination of your life satisfaction and the fact that you're high in positive emotions and low in negative emotions. So you're not feeling depressed as much, you're not as sad, you're not as worried, but you are higher in some of these positive feelings. And that's accompanied by life satisfaction, which is essentially answering questions like this, so that you feel your life is close to ideal, the conditions of your life are excellent, that you're satisfied with your life. And so a lot of people, if they really want to get at well-being, they'll combine this kind of scale with happiness measures and negative emotion measures, or positive and negative emotion measures. As an aside, if you're curious to see how satisfied with your life you are, you could quickly go and do this. If you just Google life satisfaction scale at Diener, you'll find it. But there's also a scale that we're going to have pop up in the chat, where you can go to the University of Pennsylvania. They actually have a website with a ton of different questionnaires that you can fill out. And not only will it give you your positive emotions, your happiness, your life satisfaction, but it'll give it in comparison to other people your age, other people who are the same sex as you, things like that. So that's a fun place to go. And I do recommend that if you are going to try out some of the activities that we'll be discussing today for the rest of the talk, that before you try them out, go get a baseline, just so that you can see the effect that this is having on you. Try out a few scales now, try out some of these activities and see which ones are working for you. Do a pre and post assessment. And you don't even have to be complicated. You could just use smileys if you want and just see if you go from a 3 to a 6 or if you go from a 3 to a 1, right? Figure out which direction this activity is helping you. But I think what's really important, and I'll probably emphasize this point more than once, is that not everything will work for you. And so it's very important to kind of figure out for you what's helping you with the happiness. And there's certainly apps too now that can really help you with this. Like there's an app called Track Your Happiness, which does exactly this. Okay, so where do I begin? So I will first say that there's no way I can get through all of positive psychology for you today. I teach an entire class on it in the spring. You're welcome to audit it. Come join me and the 300 students who I teach this every year. But I'm going to focus today on ones that really I think are relevant to the pandemic, either because of research or because of just stress and health relationships. Some of them are going to focus on happiness as outcomes, some of them focus as well-being, but broadly, these are things that are known to improve well-being and drop stress and or improve health. And so that's kind of how I'm going to pick which ones. But this is not meant to be inclusive. This is just to kind of give you a taste of what's out there. And I encourage you to go out and look for other things. If you just Google positive psychology activities, you will find a million of them. And so I'm just going to give you a little sampling. Now, I will also say to proceed with caution. So I like to use kind of a traffic light analogy, which is that, you know, in some cases, we're in a sort of red light state where everything is awful. We are completely overwhelmed. And, you know, maybe the only activity I can manage is to breathe, right? And I'm going to do a breathing activity because all I need to do is get rid of those feelings of being overwhelmed and being stressed. But then other times, and I'm sure you guys have felt this. I mean, I certainly have had this during the pandemic, right? Some days you're actually like, hey, everything's going okay. I feel great. I'd love to do something that's going to give me resilience when bad things happen in the future. And those are more the green light activities I'll be talking about. But, you know, sometimes these things, even if it's, you know, a good match for your context, maybe for your personality, maybe because of where you grew up, maybe because, you know, of your age, some things will not resonate with you. And that's okay. We know in this literature that not everything works. And so in a lot of the intervention studies, what they do is they really focus on giving people a range of activities, which is what we'll do. So the first thing I'm going to talk about is yellow light activities, which I consider activities that are just sort of helpful in general right now. So you got maybe some moderate stress from work, from your life, from having kids at home, from the pandemic, but you're kind of okay. You know, you're managing it. It's a little bit of stress. And so my goal would be right now for this kind of situation to kind of train your brain that there is good in your life, that there are some positive things worth focusing on. And that if your stress isn't completely overwhelming, we can, you know, at least give yourself a little break with these happiness tools. So some of the activities that I think are especially good for this are things like savoring, an activity that raises gratitude called the 3 good things, a range of expressive writing activities, and just in general, the things you know are good for you, right? If you feel lonely, go be social, you know, go watch a movie that's funny, don't watch a scary, depressing movie, you know, just the behaviors that aren't even research-based, but just we know are mood enhancing. So gratitude is kind of a go-to one that I think everyone suggests because it's so easy and so low time commitment, and it's tied to sleeping better at night, greater happiness. And essentially all it requires is that, and this is typically done before you go to bed at night, to write down 3 things that went well today and their causes. Now the causes piece often gets left out, and it is okay to just write down 3 things that went well today, because what that does is it's focusing you on something positive before bed in exchange for what a lot of people do, which is late at night, you lie in bed staring at the ceiling, thinking about all the things that went wrong today, all the bad things, all the awful things. And instead, you're thinking about these positive things, and that's going to help you sleep better at night, because we know that happiness at night relates to better sleep, and it also relates to better mood the next day. Now, this really works because it fights hedonic adaptation, which is this tendency for us to kind of go back to our baseline and kind of be wherever we were, and just keeps us just a little bit more focusing on the positive than the negative. So let me show what this kind of looks like in some examples. And, you know, it varies how often you should do this. You probably shouldn't do it every day because you'll get bored by it. Most people recommend doing it like 2 or 3 times a week. It just takes a couple minutes before bed. So if I said, just the good thing, I might say, hey, I bumped into Dave. That was good. That would be an example of just writing down the good thing. But the causal piece is, haven't seen him for ages. I'd forgotten how he makes me laugh. And so that extra causal piece of, it was good because I laughed so much with him, it just helps you remember it better. It forces you to think about it a little bit more. And really critically, it might give you some insight on something you could do in the future that might also raise positivity. So for example, really enjoyed lunch today. Lovely to grab 20 minutes in the park and chat with Joe instead of eating at my desk. It happened because I thought it would be nice and I suggested it, and Joe liked the idea too. So this tells this person, oh, you know what? I actually got happier because I didn't eat a sad desk salad, you know, and maybe I should not do that tomorrow. And so it teaches them something. And so this is a great simple activity. Kids can do this. Anyone can do this. It takes 5 minutes. It's very popular. It's not a huge whopping effect, but it's, you know, consistent. So the key here is that what we're trying to do with your brain is to move you away from the natural tendency, which is to have bad things that happen be like glue, right? Where they're stuck on your brain and you can't stop thinking about it, versus the good stuff that I call it more like Teflon, right? Something good happens to you during the day, like you get an email that says you got an award. And what do? You like smile, close the email, go back to work, right? And I think so many of us are guilty of not celebrating the good things and not thinking about the good things that happen during the day. And so we're trying to shift that brain natural tendency to focus on scary, bad things, which is very natural, right? It's a very protective response, it's adaptive, but it's not good for us. And so we're trying to train our brain to really make our good stuff stickier. So another way to do that is to practice savoring. And that, like the gratitude, is really just trying to get you to notice and appreciate the positive things going on in your life. It's just the positive opposite thing of coping to stress. So we call this kind of paying conscious attention to the things that you experience in pleasure. It could be someone else's pleasure. It doesn't have to be your own, but it's essentially cognitively, consciously attempting to extend how long something positive that happens lasts. You want to have that experience go on for longer. So there's different ways of doing this. And there's a worksheet that I'll have linked in the chat that talks about different ways of doing this, but it's pretty obvious, right? You want something good to happen. If someone emails you and says you got an award, share the good news with someone, call your mom, email your friend, tell them what happened, describe it in detail. Don't let that positive experience end. Keep it going, share it. I think a lot of people worry about making other people feel bad, but what we know is talking about something good with someone else actually raises their mood too. So you're actually helping that person. You're not making them feel bad. There's the idea of taking a mental photograph. If you watch The Office obsessively, when it was on, I was like this. Jim and Pam talked about this at their wedding. Weddings go so quickly, you have to take a mental photo and try to remember that moment and slow it down. And that is kind of similar, to the idea of, just letting yourself get absorbed in the moment, reminding yourself how quickly time flies, so that when something good is happening, we try to slow it down, really focus on it. Don't just look at your phone. Don't just think about the next thing you have to do. Just let it last. And if you still don't have a good idea of how to do this, my recommended activity for you is to do something called a chocolate meditation, which sounds as good as it sounds good, and it is really good. And essentially the idea here is that, we normally eat a piece of chocolate, even a Hershey's Kiss, but it's Valentine's Day almost, we're going to be eating delicious chocolate soon. How do we normally eat it? We just pop it in our mouth, swallow it. We barely notice it going down. You might have like a second of enjoyment from it, but with a chocolate meditation, what it has you do is, hold it in your hand for a minute, smell it, take the wrapper off slowly, feel the texture of it, put it in your lips. What does it feel like on your lips? What does it feel like on different parts of your tongue? Let it roll around in your mouth for a while. And really, this activity of eating a Hershey's Kiss, you can extend it to about a 5 to 7 minute activity. And you can imagine how much more joy you're going to get out of eating a piece of chocolate if it takes you 5 minutes, and as compared to how we normally eat it, which is mindlessly while reading our email, barely tasting it as it goes down. And again, I'm dating myself with how old I am, but there's a great Ally McBeal episode that talks about this with coffee as well. How like the first coffee of your morning should be this like amazing, and in their example, orgasmic experience, right? Coffee is so delicious, it helps us, but most of us just drink it without even noticing it. And so this is something you can really try to slow yourself down at multiple points during the day and really just savor these positive experiences that you would normally ignore. Okay, and then a final activity that can really also help with this sort of extended period is savoring, is savor writing. So writing is often talked about as a way to kind of get through and work through bad situations, kind of get through like cathartic, get some catharsis, or, make sense of bad things that have happened. But research has also shown that we can really strengthen our positive memories by doing the exact same thing and just spending 20 minutes writing about really positive, intensely positive experiences and details. And again, this is almost just like a different way of savoring. We're just bringing up a past positive experience that we might think about normally in a very short way, in a very superficial way, like, oh yeah, that vacation last year was great. But instead you spend 20 minutes, writing about, who you were with, how it felt, your deepest emotions during that experience. And there's just so much great research on how writing really helps us. And this also is true of if you're going through something bad right now, writing about it can really help you process it. And Jamie Pennebaker has some great books on this topic if you want to explore writing a little bit more. So the idea here is just a simple shift of behavior and focus. You can improve your mood. You know, you can be really depressed when it rains, or you can think about how, you know, it's filling the aquifers and it's keeping our trees alive and it's preventing drought, right? So these just little tweaks can really help. So then we can think about green light activities, which are you're feeling really great. You've got energy. You know, this is one of the few high points of the pandemic where you feel like you can do anything. So what can you do in this case to kind of protect your mood from future stress, keep you going? And in this case, it is related to what Michael was saying before about vacation. So what we know about happiness is that if you want to know how to spend your money, spending your money on experiences typically has more bang for your buck than a material purchase, like a new watch or a new necklace or something like that. You know, I think we covet a lot of these kind of material purchases, a nice purse, but what's really going to give you happiness is vacations. And right now we have such a low happiness baseline for vacations that I think like anything is going to make you feel good. And so you can get this long boost of anticipatory joy by spending some time now, like really planning out what you're going to do when this pandemic is over. You know, find the tour you want to go to, find the hotel you want. You don't even have to book it yet if you're not sure if, you know, when everything is going to be travel friendly, but just imagining this in the future and then eventually getting to do it is really going to give you some optimism and hope for the future that you might be missing right now. Because I think what a lot of us don't have right now is hope, you know, or optimism. We're just so worried, you know, and it really capitalizes on that anticipatory joy of like, you know, something good is going to happen and you can't wait for it. And this really does have a long lasting effect. Similarly, you know, you can write about the future. So if you don't want to plan a vacation, just write about your best possible future. You know, you could do this for like a year from now. What do you want your life to look like? You can envision that you've worked really hard at some goal that you want to achieve this year, you know, that you want to do before the pandemic is over, by the end of 2021, and just write about it and think about how you can use your strengths to achieve that. And that kind of, you know, hope-focused writing where you're really hopeful that something good will happen and optimistic that these good things will happen has also been shown to have very long-lasting well-being benefits. And if I can send you an example of a hope plan that I've done with my own classes, if any of you are curious, my email will be available at the end. I don't have time to go over it now because we only have about 2 minutes left. But this really kind of future-oriented writing is super helpful. And so I do recommend that as well. Now, one thing, and I'm not sure if there have been any webinars about this, but I don't have time to go into it, but you know, you have to have the energy, you have to have the time. I know some of us have kids at home, we can't do this, but the one really big bang for your buck if you have the energy and resources is right now to do something good for someone else. This has been shown to have such wide well-being benefits. You feel useful, it gives you meaning to life, meaning in your life, it has lasting social relationship benefits. And really, it's probably the biggest bang for your buck that you can do, you know, and it could be anything. It could be, you know, volunteering to tutor a young child who needs it. It could be helping getting groceries for someone, volunteering at a charity, walking dogs at a shelter, you know, whatever matches your moral compass of what you think is good and, you know, gives you some purpose. This can really help. But I you know, I do want to have the caveat that, again, I know most of us don't have the time for this right now. This is a harder one, but there might be small things that you can think of that can help. And these small acts of kindness, like even just buying someone a cup of coffee, can actually have a pretty nice happiness bounce. So it really can make a difference. It doesn't have to be, you know, that you move to another country and build schools. It can be something small. So I've given you a bunch of kind of these future-oriented plans, volunteering, hope plans. I didn't get to talk about all of them because of time, but really this will help you think forward at a time when I know a lot of us are very pessimistic. Now, the final thing I want to say is there are times, and I think I hinted at this earlier, where you might have a red light, right? You're just overwhelmed, you can't do anything, you're so stressed. And I will say that at this point, some of these happiness activities are not going to feel good to you. You know, sometimes we can't be mindful because our mind is racing and we're overwhelmed and we're panicked and we just can't do it. And so at this point, it really might just be more about energy management and taking care of yourself. You know, take a shower, you know, go to bed early, prioritize your sleep, maybe talk to your doctor if you're having insomnia problems, you know, plan a safe social activity, go into nature, you know, just these simple things that we know are stress reducing. And that might be how you need to start before you can do any of these happiness activities. But I will say that there is data that says that people who are clinically depressed do benefit from the kinds of well-being activities I've been talking about. So this really is something that everyone can do. But from my perspective, if we're looking for just like some things when we're in that red light mode, and I know I'm out of time, I'll just do one more minute, is that we can help ourselves by just understanding what I talked about at the beginning, which is our body is stressed out. It thinks it has to run away from a tiger, thinks it has to run away from a bear, and it's having this physical response to it, which is hurting us. And so sometimes, even though it feels awful to do it, just go exercise. Because what we know is that regular exercisers have more than a 20 times greater likelihood of being in the highest level of happiness compared to less frequent exercisers. And it's partially due to the serotonin benefits, it's partially due to endorphins, it's partially due to, meeting that stress demand that your body is trying to respond to. It's just getting rid of that nervous energy. And it really can help, even though I know sometimes it's hard to get out the door, but even just a brisk walk can really help you feel happy. And then I will say, everyone always asks me, what am I doing right now to be happy? And I will say, exercise is my thing. I have just been, you can kind of see my Peloton in the back corner of the room, and this is the only thing that's kept me sane this year. So I know exercise is hard for us to make ourselves do, but if you can, it's really a happiness booster. And if you can't exercise, I will say that the one thing that I think is not talked about enough is really realizing how this pandemic is a giant experiment in uncontrollability, right? We don't know when it's going to end. We don't know when we're getting our shots. We don't know if our loved ones will get sick. And one thing that I can tell you from health psychology that is so useful is that you can fake control, just like you can fake a smile, and it will help you live longer. It will help you be healthier. So there's great work by Ellen Langer that shows that just telling people that they have to take care of their own plant in a nursing home and telling them that they can pick what time they watch shows resulted in them living longer. Rich Schultz had work that showed that just telling people they can control when visitors come to visit them in a nursing home and how long that visit is resulted in them being happier, taking less medication, living better lives. And you can even improve your immune function if you just believe that you have control over something, even when you have absolutely no control. And so this is just some of the mortality data, but I'll just tell you it works because I'm almost out of time, or I am out of time. But for your own sake, if you want to believe that you have control, if you want to fake it right now, just spend 5 minutes writing about all the things that you actually do have control over. You can control what time you wake up, you can control what you eat, you control what times you work, things like that, what you watch on television, and that will help. And also add some predictability to your life. If you control your own schedule and decide, I'm going to wake up at this time and I'm going to take a shower and then I will brush my teeth and then I will coffee and I'm going to watch this Netflix show every night, that simple schedule actually gives your life meaning and, from the control and predictability that it's offering. So, it's better to not panic about things we can't control. I know that's what the news wants us to do. I know it's what we're all doing. But if you can just give yourself a little bit of a reminder of what you can control when we're spiraling and really negative, that can really help. So I hope I've shown you that there's a lot of ways to enhance your happiness. I know it's just a little taste of it. All of these are free. None of this costs anything to do. So that's the really good news. And I've got all these caveats that we can talk about afterwards. But like I said before, don't expect everything to work. Take before and after measurements to figure out what's working for you and really think about what you need and which activity is going to help you with that. Because happiness is an answer right now. Stress is our problem, and you need to give yourself permission to really focus on your happiness. I know it seems selfish, but you need to stay healthy, and that should be your priority right now. And so I hope that some of these activities will help you with that. And thank you. Thank you for all your time.
Professor Pressman, that was fantastic. I have to say, I really, I'm sure the audience agrees, really enjoyed that. And there were several comments that resonated with me. So first of all, I want to make it clear to anybody who knows me, my smiles are real, not fake. But I'm glad, even if they're fake, that they're helping other people. That's good to know.
It's still helping, yeah. And smiles are also contagious. So if you smile, someone else smiles back, and so you're helping other people. It's
funny because you mentioned about coffee, enjoying the coffee, and it's funny because since COVID has impacted our lives, I've given up my commute many days a week. I do commute, but not every day like I used to. And I have quite a long commute. And so my wife and I now wake up earlier. We go to bed a little earlier, and we really savor our coffee in the morning. We spend about a half an hour together just drinking our coffee and enjoying the moment, which I never could do before. And that's become a really an important start of almost every day for us. I mean, once in a while, we'll skip it, but not too often. So thank you. That's a great observation, and I'm glad it's a good coping mechanism, even though I didn't realize it was when I was doing it.
No, and the other thing that's good about that is realizing that you're finding a benefit from something bad happening, right? Like, I think that's a really important activity I didn't talk about, which is that, like, I think most of us focus on all the bad parts of the pandemic, but there are these positives that are coming out. So that's such a nice, lovely example of something new that, is helping with your relationship and your happiness.
And then we have some great questions I'm going to get to now. But first, last comment is that, you sort of described a dean's life, which is enjoying others' happiness or success vicariously. Because once you become a dean, you don't have a lot of personal accomplishments anymore, right? So thank you for that. So let's get to the questions. We have some great ones. So first of all, a really good question. How can I possibly handle my emotions when I read such varying theories on things like herd immunity in the media? Like, will it be 60%, 80%, 90%? Will it be by June or by August or by 2022? Trying to hope for the best, but the media sometimes is full of doomsayers, right?
Yeah, so I didn't dwell on this too much because I got in trouble from a reporter. So I get interviewed a lot right now about stuff like that. And I mean, my advice is always stay off the news, right? Which the media doesn't want to hear. But the news is designed to kind of make you feel like you have to constantly keep checking it because there's an important new piece of information. And I think that's exactly what the herd immunity stuff is, right? It's like screaming for attention. How many people have to be vaccinated? How many people have to get sick? When is this going to happen? And the reality of it is, and this is kind of what I said at the end about uncontrollability, you have no control over this, right? You're not going to be able to go out there and inoculate people yourself and like make people get inoculated or get people sick. And so my advice in that is to really cut down your news exposure because it's just not helpful to be constantly obsessing about something that you don't have control over. And so Roxy Cohen-Silver, who's a professor in my department, has done work, and she has shown that you can actually get the equivalent to PTSD from obsessively reading the news, especially when there are disasters happening. And so her advice is more like 15 minutes a day instead of 15 minutes an hour, which is what most of us do, right? So that's how I'm living my life right now. I am allowed 15 minutes of news. I usually listen to like an NPR morning podcast, and then I'm done. And that will help you more so than anything that, because how do you cope with something uncontrollable except to say, well, there's nothing I can do with it and try to think about other things. And that's really, the best strategy is focus on what you can control, your own safe behaviors, wearing masks, washing your hands, that kind of thing.
And you talked about exercise and sleep, which is great. I support that myself, and I think it's so important, underestimated perhaps. But tell us about happiness in relation to music, dancing, and movement, because it's not something that I'm necessarily strong at, but other people find great pleasure in that. So if you would give us your thoughts and any data that exists.
Yeah, no, that's a great question. And it's, like I said, I couldn't possibly talk about everything in 30 minutes. And, music is a very common emotion manipulation we use in the lab because it is so successful, right? Like there are songs that I'm sure that make you cry, but there are other songs that wake you up and get you out of bed, right? And so trust your instincts, right? Spend some time if you're feeling really sad and you really want to get yourself out of it, create a happy get up in the morning perky playlist, and that absolutely has been shown to not only have mood benefits, but it also has immune benefits. So there's actually been studies where they look at functional immunity and circulating immune cells, and they can change from just that tiny mood benefit. It's not something that's going to last, right? It's not going to, you're not going to think back 10 years from now about that great song you listened to today, but it does have that ability to have a short-term benefit. Now, dance and art and all these creative outlets are absolutely tied to well-being. There's entire lines of clinicians that focus on dance therapy. Dance is also beneficial because it is exercise, because it involves music. So you kind of get a double whammy of the exercise benefits plus the music benefits. Obviously, depending on what you're listening to as you dance, obviously there could be very sad, melancholic dance. But again, faster, upbeat songs partnered with exercise is going to be a very healthful activity. But so is really, any creative activity that, brings you flow, which is this kind of feeling of being really encompassed by it and you kind of lose track of time. That's a state that's been really shown to be tied to long-term well-being benefits, life satisfaction, meaning, things like that. On top of happiness, because you're doing something that really matches your skills and brings you joy and purpose and things like that. So doing activities that are creative right now. If you have the time, if you don't have, an insane life right now, and you can find that time to focus on these kinds of, creative leisure activities, that absolutely buffers stress and has great health benefits.
Any comments on the role or impact of social media on happiness or unhappiness?
Oh, it's such a complicated question. Social media, I think was everyone's favorite demon, the same way that violent video games were for a while, where everyone was convinced that, violent video games or violent movies with swearing were going to destroy children and make them depressed and unhappy and angry for forever. And I mean, the reality of social media is it partially depends on how you use it, I think, is what we're really learning. So if you're using social media to consume, and I have a study that we're writing up right now on this, to basically consume COVID content all day, that is not good for you. It's just going to make you depressed. It's just going to make you worried. It feels good because it feels like you're getting control, right? It feels like you're getting this information that no one else has, but it's not actually helping. In fact, it typically seems to be tied to actually being more worried, more depressed. And that's true of illnesses too, right? Like everyone is Dr. Google now, where you can I have this symptom and I look it up on the internet and now I think I have this disease. It's kind of the same broader problem. However, what we also know about social media, and this is especially true for younger people, but I think it's true for everyone, is if you use it in a productive way where you're actually trying to connect to other people and not just passively read it. So not just endless scroll, but you're using it to find out how a friend is doing, and you ask them how they're doing, or you're engaging in an interaction with someone and you telling jokes or asking questions and things like that, that you can actually connect meaningfully. And in a time when we're so isolated, that can be helpful. And on top of that, I think right now what we need more than anything for the stress that we're going through is social support. And social media has now become a really good way to get support, right? Like if you're like, hey, does anyone know where I can get N95 masks? And a bunch of friends tell you where they found them. That's real social support that helps you. Does anyone know of a babysitter who's COVID friendly and is actually wearing a mask? You can get information that will help you be less stressed. And, even emotional support, just someone saying, hey, I hope you're okay. I know, you're really going through a tough time at work. Those things, even when delivered over social media, can help. But that's just a different way than how some people use it, right? Versus just going on Instagram and posing in pictures, and, that's not going to help you in any way. So, you just have to use it in a way that actually is going to make you feel better.
Great. And one more question. And you kind of touched on this a little bit, but maybe you can expand or give a different nuance answer. How do you help those who just tend to be grumpy or have a hard time smiling?
Yes, and I didn't really touch on it too much, but I will say there is a whole field of work on how happiness is genetic. Not all of us are born lucky enough to come out of the womb smiling, right? Some people are more Eeyore than Tigger. It's well established. I think it goes back to the matching hypothesis, right? So thinking about the person and what will work for them, you may have different strategies for what will match their ideal state. So someone who's permanently depressed, who is never going to be that jumping off the wall cheerleader kind of person, telling them to go do something that's really exciting and high energy is probably not going to be a good advice. But maybe they could focus on something more calm oriented, which more matches their baseline arousal. So maybe that person would do better with meditation or mindfulness or painting, something quiet that's still positive, but it doesn't have that kind of cheerleader kind of American positive orientation that we all love high arousal positivity. The other thing is to not necessarily tell someone that you're trying to make them happier. Some people get some reactance to that. And certainly when I tell people to smile, I mean, there's a whole social movement with feminism of stop telling me to smile, right? So some people really don't want to be told to smile, even if it's good for them. And so thinking of ways that you can talk to them about a suggested activity without calling it happiness is also, I think, a good strategy, right? Oh, I read about this great stress buster where you write down, for 20 minutes about all the things that, some positive memory. And so that you're not getting them to have that kind of don't tell me to be happy emotional response. And so kind of finding a way that matches the person and also is a less threatening approach to it. I don't know. And for me too, I will also say giving people data that happy people are 20% less likely to get sick or heal 40% faster, like those kinds of objective immune data, like that often helps me too. I think I've convinced a lot of pessimists that, okay, I should probably do this. It's probably good for me. So biological data for me has been a good selling point as well.
Well, great. Thank you so much. Michelle?
Yes, wonderful. Thank you so much, Professor Pressman, for such a wonderful and engaging webinar today. That was truly, actually, it made me smile throughout the whole presentation. So thank you. And thank you to Dr. Stamos, to Dean Stamos, for hosting today. You're always just a natural at this. So we might have you host all of the rest of them too. Such a great experience. What you'll see on the screen right now is the rest of our Working Well Remotely webinar series. It's every week on Tuesday at 11 o'clock, and there's some very interesting topics coming up. So again, I want to thank you to all of our participants, to our attendees for coming today. And again, if you missed this session or your colleagues missed this session, they can be found on the Working Well webpage. Okay, well, thank you. And I hope everyone has a great rest of the day. Bye-bye.